You are a new nurse and you're still trying to figure out how to stand up for yourself, how to use your voice, how to challenge the system, how to challenge your patient, how to challenge a physician, or how to challenge management. When things don't feel right, but you're not sure how, and it still feels awkward, this video is for you, my friend. I'm Jessica Smith Dos Santos, also known as Coach Jess. I've been a nurse for almost 20 years, and I currently work full time in the emergency room. And one of my primary roles is training our new graduate nurses. So, helping them find their voice and learn to challenge the system in ways that are empowering and productive and impactful is one of the things that I am tasked with. So, in this video, I'm going to share 6 ways that you, as a new nurse, can safely challenge the system with confidence. So, number one, always advocate for your patient. I want to just be the voice that reminds every nurse out there, whether you're a new nurse or you've been at it for 20 years like I have, that we came into healthcare and became nurses for one reason and one reason only. And that was to give extraordinary care to our patients. It was to help them. And when we can advocate for our patients, when we decide that we are on their team and that we are here to serve them, it makes challenging the system and finding that voice 100 times easier, because you know that your primary job is to be an advocate for your patient, is to step up for your patient's desires, is to stand up for what your patient wants for their own health, and to be an advocate for what's in their best interest. This also comes with a warning. As a nurse, you are the last hands and voice and eyes in a treatment process. And so if something doesn't feel right, that's been ordered, or that a physician's asking you to do, or that the system is telling you to do, you have to be willing to say, hold on, this doesn't feel right. It doesn't feel like the right thing to do for my patient, and I'm not comfortable doing it. And stopping the train and not doing it until you ask some clarifying questions and feel good that what you're about to do is also aligned with what's best for your patient. I have a little story for you. So, I was not a new nurse. I had been a nurse maybe about 4 years, 3 years, 4 years. Um, but I was new to the emergency room. And I went into the emergency room and I had just given a patient that they were considering discharging a second dose of morphine because she was still having a lot of pain. And on the tracking board, it told the charge nurse that the patient was ready for discharge. What the charge nurse didn't know is that the doctor ordered a second dose of morphine and I had just administered it after that, like, hey, the patient's being discharged notice flagged her. Now, in the emergency room, and honestly, on every floor in the hospital, it's important to keep the patient moving through the process. You don't want to hold on to a patient if they're supposed to be being discharged, because it's not in your patient's best interest and it doesn't help the flow of your department. However, you and I know that a patient who's just received a second dose of IV morphine is at more increased risk for stopping breathing. It depresses their respiratory drive, and the risk of that increases with repeat doses. So I had a charge nurse pressuring me to get the patient out of the department because she needed the room. So I explained to her, hey, I just gave a second dose of IV morphine, which I know you can't tell on your side, but I'm not comfortable discharging the patient until I monitor for the required 30 minutes to make sure that she's going to continue breathing okay. Because that's following policy, it's following best practices, and it's advocating for what's really truly best for my patient. And the charge nurse said to me, I don't care what you just did. I need the bed. Get the patient out of the department. Now, that's when that awkward moment comes of like, I know that I need to stand up. I need to challenge the system for my patient. And I need to do it in a way that's constructive and has a good outcome for my patient. And I told the charge nurse very respectfully, that's not best practice. It's not in the best interest of my patient. And if that's the decision that you want to make for the department, I would be so happy to give you report, sign off accountability of that patient to you, and you can discharge them. And guess what? She didn't want to take responsibility because she knew that it was not best practice and it was not what's best for the patient. So that's just one example of how, when you're advocating for the patient, it makes it very, very easy to know what to say and what to do. So if you're ever feeling uncertain, just ask yourself, am I advocating for my patient? Is this in my patient's best interest? And from that point, it can help you be more confident in using your voice. Because if it is in your patient's best interest, then this is what you signed up for. You signed up to be their advocate. You signed up to serve them. You signed up to give them extraordinary care. Tip number 2 is ask clarifying questions. When you're in a moment where you're feeling really uncertain, like, I don't know if I should be doing this, I'm not sure if this feels right, I don't know if it's just lack of knowledge or awareness or fear, or there's something that I'm not sure about, always ask clarifying questions, because it's the worst feeling in the world to do something without fully understanding, why am I doing it? Is it in the best interest of my patient? Is this going to create a good outcome for my patient? And is this something that at the end of the day, I'm going to go home and feel good about? Or is this something that at the end of the day, if I don't ask questions and do it anyway, am I going to lose sleep over it? And let me tell you, friend, I have lost a lot of sleep over things that I have done because I didn't ask the right question and I carried doubt. And when you can step into just choosing to get really curious and ask clarifying questions, it'll lead you to a decision that you feel good about that's not going to keep you up at night. Another really simple example is I had started working in pediatrics. And so the dosages of medications I knew were weight based, but I didn't quite know like what's the exact right dose. And I had two twin girls, they were both 12, and they were having an asthma flare up. And my job was to give them oral prednisolone. So I went to the Med Select and I pulled up all the medications, and the girls were twins. So they were in the same room together. And I had 12 syringes of oral prednisolone in my hand. And I thought, this seems like a large amount of medication for two children. Let me call the pharmacy and just ask a question. It didn't feel right, right? I was like, I'm just not sure about this dose. I need more clarification before I just go and check off the box and administer this medication. And so I called pharmacy and I said, hey, the physician ordered this dose. You've already verified it, giving it your blessing, but it still doesn't feel right. Can you please double check the order and their weight? And sure enough, the pharmacy said, oh my God, I'm so glad you called me. The max, it's correct for weight based, but we cap that. And if you had given it, you would have overdosed both of those girls. So just asking the clarifying question, like, this doesn't quite feel right. Can you help me understand this? Was a really good choice. Now, here's a caveat to this is I know that the medical profession is not always the most open to clarifying questions, that older nurses or pharmacists or physicians, they may feel like you're challenging them, like you're doubting them. And I want you to know that, again, it's in your patient's best interest for you to be willing to get uncomfortable and say, I'm not trying to undermine your authority, but I don't know that this feels like the right thing to do. Can you please help me understand it? So remember, when you're asking clarifying questions, it's coming from a place of, please help me understand so that I make sure I'm doing the right thing for my patient versus, you did this wrong, you need to fix it, right? There's a complete difference in the approach. Number 3, stay up to date on evidence-based practice. You can never, ever, ever go wrong when you have the most current evidence-based practice recommendations and you are practicing in alignment with those recommendations. If you ever get pushback because maybe you're taking too much time or that's not the way we do things here, and being a seasoned nurse, I have my own attachments that I'm currently working on, right? I was like, well, that's not the way we used to do it, but there's new equipment, there's new evidence, there's new policies that suggest that the way we used to do it isn't in the best interest of the patient. And there are new ways to do things. So this is one of the beauties of nursing is you get to be a lifetime learner. And I highly encourage you to stay up to date on your evidence-based practices. You can do that independently. You can do that in cooperation with your hospital educator, with your unit-based educator. But as long as you're staying up to date with evidence-based practice, it is literally impossible for someone to come to you and say, hey, you're not doing that right, or I want you to do it this way. And you can very easily say, I understand you want me to do it this way. And I recently learned via evidence based practice that this is the way that they're currently recommending to do it. I'm comfortable following what the evidence based practice suggests, and I just don't feel comfortable doing it the way that you're suggesting. It makes it very, very simple because even as a seasoned nurse, it's impossible to argue with evidence-based practice. Okay. Tip number 4 is report unsafe practices. And I know this feels kind of bad, like maybe I'm a tattletale, but every hospital has systems for reporting unsafe practices in place for a reason. Because again, refer to tip number 1, right? Advocate for our patients. If you're seeing something done that is unsafe to a patient, it is your obligation to speak up, to use your voice. So whether you've developed the skill to address it directly, like for example, I was working with a tech who I watched go into a room, did not wash his hands, did not put on gloves, and was about to start an IV for me. And I just popped into the room and I said, hey, here's some hand sanitizer. Do you want 1 squirt or 2? And I put it in his hand and I said, what size gloves do you use? Here you go. Thanks for your help, right? That's one way to address an unsafe practice in the moment. But if you're not comfortable addressing those things in the moment yet, and here's my other hot tip for that. When you're addressing them in the moment, you don't want to make the person wrong. You want to come into that conversation with like, hey, I really care about you. And I know that you really care about your patients, about our patients. And I don't know if you know this or not, but this is what I observed. And how can I support you in doing it in a way that's in the best interest of our patients next time? Right? That's the conversation versus you're wrong, you suck, you didn't do this right, I'm reporting you. That's feeding that old culture of nursing eating their young, or the profession kind of turning on each other. And remember, we're all on the same team. We all have the same purpose of serving our patients well. So reporting unsafe practices, whether it's in the moment, whether it's going to your charge nurse, whether it's going to your direct supervisor, following that chain of command and knowing where can I report this within the hospital reporting system? What phone numbers do they have in place? What computerized systems do they have in place for reporting? Now I'm going to tell on myself. I made an error where I did not label a patient's sample correctly. So you have these little slips and you have to write down like the time and your initial on the little sticker, and you have to remove it and then put it on the sample. So what I had done because I was rushing is I just put the slip in the bag and threw the sample in without putting the sticker on the sample. The lab cannot safely and securely say this sample came from this patient because there's no identification on it. So I took accountability for my own action and I actually filled out an independent report, unsafe practice report, because I had made the error and I want to be part of the solution, right? I want to take accountability for all of the things that not only I do, but how I support the people in my department in doing things well. Because remember, we're here to serve the patient. We're here to advocate for our patient's best interest. And that means not cutting corners or allowing unsafe practices. Number 5, challenge outdated protocols. So this one can get a little tricky because hospitals are very attached to their protocols and they put a lot of time into creating them. But when a protocol is more than 1 or 2 years out of date, they should be updated regularly and annually. So if you've been looking at evidence-based practice and you're looking at a hospital protocol that's telling you to do something that's not aligned with evidence-based practice because the policy is out of date, it's also your job to be a voice for the processes that keep our patients safe. So take that concern to your hospital educator. Take that concern to your director, take that concern to your supervisor, and follow up with whoever creates the policies so that they can make changes. Last but not least, tip number 6 is utilize the right mentorship. And I had talked a few videos back about knowing who your allies are as a new nurse, knowing those key people that you can go to that will have your back versus the people that will tear you down for using your voice. Now, when I say using the right mentorship, what I mean is knowing who those allies are, who are going to listen to your concerns, to what you're challenging, to your challenges with giving adequate patient care with an open mind, with a willingness to listen, to understand what it is that you're saying, with a willingness to truly hear your concern and say, are we doing right by our patients in our department? And it may take some time to discover who those people are. I started a new job about a year ago in a new ER, and taking time to learn the people, it took me about 6 months to know who are my allies, who is the right mentorship that I can go to, and who are the ones that are not safe, who are the ones that are not open, who are the ones that are too attached to this is the way we do things, that can't hear my concerns. And I'm saying this not with judgment. I'm saying this with, if you're truly going to be able to use your voice, you have to know where the appropriate place to use it. Because the last thing that I want for you is for you to try using your voice with the wrong mentorship and get shut down. My goal is to give you the words, to give you the confidence, and to give you the right connections so that you feel comfortable speaking up and challenging the system in ways that are safe for you, or for your patient, and in ways that encourage openness and curiosity rather than shutting you down. Because let me tell you, friend, as a new graduate nurse in these departments, yes, you have a lot to learn, but I tell you this from the bottom of my heart, like I have goosebumps because I truly believe that you are every unit's greatest asset. And you are the future of our profession. There is going to come a day when myself is going to retire, when that nurse that's too attached to the way things are is not going to be here anymore. And you are going to be the next generation of the hands, the heart, the feet, the face that's caring for our patients. So I want to encourage you to just know that you have a right to use your voice, and your voice is a powerful mechanism of change within a department. Don't ever doubt how incredibly powerful you are, and don't be afraid to lead by example. I hope these tips have given you some thoughts to think about, some skills to try, and some real true stories so that you know that you are not alone. Until the next perfect time, much love.